Doctor, what is frozen shoulder?
So frozen shoulder is a condition where the patient cannot move his shoulder in any direction. Most commonly it is seen with the diabetes, and people will misdiagnose it as a cervical spondylosis also, because frozen shoulder is only a joint, not the neck pain or something. Most of the times the patient presents with the neck pain. That's why so many people will get misdiagnosed like a cervical spondylosis. So frozen shoulder is not meant for only diabetic patients and other patients who neglect their injuries. Obviously the shoulder will go to frozen condition. So any direction, if the patient is not able to move, that is called a frozen shoulder.
Yeah, doctor, what are the signs and symptoms of frozen shoulder, doctor?
So frozen shoulders, the first thing is pain and loss of movements. So pain, usually the patient feels more in the night time. He can't able to sleep on the shoulder. They have to change their positions frequently. Second thing is, if they want to wear a shirt sleeve, and ladies like any sleeve, they can't able to put their hand up, and they can't able to do that. And second thing is, they can't able to comb their hair, and they will feel trouble. And most of the times they will do have tricky movements. In order to in order to move the shoulder freely in this direction to comb hair or something, they will bend their head and they will lift their shoulder blade. That's why most of the people will have the neck pain or shoulder blade pain. Some people will have chest pain also, because they are not using the proper muscles which are meant for that. Those are freezed. They are using their alternative muscles, they will have pain.
So doctor, tell us, how severe is this pain?
So pain is excruciating. If it is intensity is reached for few people diabetes, after 3 months the pain will be more, because it's the state of freezing. Initially it's 3 stages. At stage 3 they will have almost freezed joint. They won't move at all. They can't able to sleep. They can't do any actions with that. So it's more excruciating. They will, most of the times they will go for the doctors or native treatments or physiotherapy. If they got right person to diagnose what is their problem, they can give in a right direction where to go and what to do.
So doctor, what are the first signs of this frozen shoulder?
First sign is pain, not able to sleep on the shoulder. That is the initial sign the patient will present. If they are like that, we have to suspect, and most of the times we need to, if we are the doctor, we need to check or rule out there's anything wrong with the cervical disc problem also. Whether it is a frozen shoulder or cervical disc, both can present in a similar manner, but we have to rule it out.
So doctor, why does this frozen shoulder hurt so much?
Yes, people will come in the midnight because of frozen shoulder also. Sometimes I am having, if it is a left side, they will think it is a heart or something also.
Yeah, in the middle of the night also it will.
Yes.
Okay.
So because they can't able to sleep, pain will be excruciating, and some people will present maybe left side pain coming to the hand, radiating to the hand. It may be a heart attack or something because on the left side. If it's right, is a different, and the pain is so severe, the patient will get panic also. So they should get a right choice and right doctor. They can diagnose their problem, so can they give in right direction of treatment, and they can go in a right choice of physiotherapy and proper treatment.
So doctor, how do you diagnose this frozen shoulder?
Frozen shoulder, first of all we have to rule it out whether a patient is a diabetic or not. In diabetic, initially with the medication and physiotherapy, most of the people will recover with some time. It's not immediate relief for him. There is the stages. With the stages, once they reach the terminal stage, automatically whatever the capsule freezed, it will get relieved. So the pain and movements will get relieved for them.
So doctor, what is the treatment for this frozen shoulder?
So the people who are not responding with the physiotherapy or medicines, next choice of treatment is a small procedure called hydrodilatation. It is like a small injection, but we will give in a quantity with a mixing of other fluids also, so that it will enlarge the capsule whichever is shrunken. So it will have a room for the shoulder ball to move. They will have a free movement. Diabetes, usually we will check whether the sugars are normal before giving that, because we will mix a steroid for 2-3 days, the sugars might shoot up and it will come down to normal.
Doctor, are there any surgical method to cure this?
Yes, people who are not responding for any of the physiotherapy or medicines, then surgery like a keyhole operation will be there, arthroscopic release.
Okay.
So whatever the redundant capsule which has got shrunken, we need to release it. If any ligament tear or muscle tear also, we need to search for it and we need to cure that also. So arthroscopy is a one-day hospitalization. Most of the people will relieve after that, and they will have better movements and free movements. And this is hydrodilatation is a daycare procedure. Arthroscopy, most of our people, it also be a daycare or one-day hospitalization for some people.
Yeah, doctor, previously you mentioned about the injection. So how often you recommend that injection?
Hydrodilatation is an injection, usually is a one-time solution. It's not to give repeatedly, because diabetic patients, the sugars are also elevated. If it is not responding to the hydrodilatation or repeated, there's no need to repeat it. We need to do a small procedure called arthroscopy, where we need to see, we peep into the joint, we have to see every corner of the joint, where is the problem is existing, and we have to correct it. So there's no point of giving repeated hydrodilatations within a short time. If it is year or 2 years after or 3 years later, if they got the same problem, you can repeat it.
Doctor, if the patient is suffering more from this frozen shoulder, so what is the fastest way to heal the frozen shoulder?
Main thing is exercises, physiotherapy.
Okay.
Prevention is better than cure, whatever you say. So diabetic patients have to check their feet because of any ulcers or something. Eventually they have to do walking to control the sugar, and shoulder movements are more important for them. They should make their shoulders more flexible, because at some point of time they will land up. We can't say how many years after the sugars, at some point of time they will get it.
So doctor, are there any particular exercises you recommend them?
So most of the patients, they have to do regular exercises for physiotherapy. Important exercise, they have to make their shoulder blade flexible, and I'm reminding that shoulder is 360 degrees movements. Make sure, and most of the exercise like a pulley, put a thread to the pulley or rope, and make sure that exercises are there. Otherwise, take a towel, and how do you clean your back? Just like pulling the towel, you can do in either directions with the two hands, so that hands will get flexible movements. This is the important exercises, simply you can do at home.
So doctor, how do we prevent this frozen shoulder?
So frozen shoulder, they should know what is frozen shoulder first. Why they should not neglect any shoulder pain, because it is a 360 degrees movement. People won't come to the doctor unless their movement is 50% compromised. Yes. Means most of the common activity for the shoulder is shoulder injured is when they are trying to get anything above the level of head from the cupboard or something. They will have small snag of pain, they will neglect it, and slowly from 360 degrees they can't able to do. Up to 90 degrees they won't visit the doctor. So when they can't lift to this much, then only they will visit the doctor. But you should be aware, the shoulder pain, and most of the people will combine that shoulder pain and neck pain, and people will think it is a cervical spondylosis that I am suffering, not the shoulder pain. If your doctor carefully examined, your movements are restricted from the shoulder, and if the shoulder is not moving, obviously the pain will go up to the neck blade and shoulder blade. So people will complain then or think that is a cervical spondylosis. It is not cervical spondylosis. Most of the times we'll have a shoulder issues only. So flexibility of the shoulder is reduced. Most common the pain symptom is night pain. If they can't able to sleep on the shoulder on that side, visit your doctor. Make sure there's nothing wrong in the shoulder or neck. Then you can do the exercises. So don't neglect the small pains. It will become large and becomes untreatable sometimes also.
So doctor, how long does this frozen shoulder take to go away?
Usually it comes in 3 stages. It comes to peak in 6 months, and after that slowly it will come down. If it is not responding beyond 6 months, means you have to think there's some other issue also existing or frozen which is not responding to the routine treatment. Then you require some other alternatives to treat your frozen shoulder.
So doctor, would you like to give any take-home message?
So most of the people will neglect the shoulder pain because it is a small pain, a 360 degrees joint. It is not like that, and most of the people will have in mind that it is a cervical spondylosis, it is a neck. It's a common diagnosis most of the people will do. Cervical spondylosis is not a simple thing to treat, or shoulder pain is also not simple to treat unless it is properly diagnosed. So don't neglect any pain and don't make it as a major problem. Do regular exercises for diabetes. Not only the foot or shoulders are also very important. They have to do the exercise regularly to prevent it if it is coming. So people will have repeated offenders, like once it comes, means they will neglect the exercise, again they will land with some other problem like severe frozen shoulders. So don't do it. First is the exercise more important, if necessary, painkillers or not.
Thank you so much, doctor.
Thank you very much.
Doctor, how dangerous is this coronavirus, doctor?
So coronavirus is dangerous, yes, but does everyone who gets coronavirus, do they die? No, because right now the mortality is expected rated at about 25%. But then it does increase at extremes of age.
Because people are so terrified because of this.
Yeah. So not everyone who gets coronavirus dies. So we will have to understand that how immunocompromised or suppressed the patient is. It depends on his earlier innate immunity. Other diseases like liver disease, kidney disease, heart disease, severe uncontrolled diabetes. So if a person is a really healthy young patient, does not have all these things, then there is a less chance that he probably may die.